Coming up on Network Africa. Côte d'Ivoire's Constitutional Council rules that President Alassane Ouattara is eligible to run for a third term in the forthcoming presidential election. Health workers battling the COVID-19 pandemic in Morocco take to the streets to protest inadequate manpower and ill-equipped medical facilities. Plus, U.S. President Donald Trump threatens to retaliate aggressively to any attack launched by Iran. Hello and welcome to the program. I'm Layo Adegoke. We begin today in West Africa, where Côte d'Ivoire's Constitutional Council has ruled that President Alassane Ouattara is eligible to run for a third term in next month's presidential election. This comes despite protests from opponents who say his candidacy jeopardizes the country's democracy. Violent protests have rocked Côte d'Ivoire since the president, who has been in power since 2010, announced his candidacy. The constitution says the president can only stay in power for 2 terms, but Mr. Ouattara has argued that the publication of a new constitution in 2016 reset his presidency. Meanwhile, the political ambition of former president of Côte d'Ivoire, Laurent Gbagbo, has suffered a setback as the country's constitutional court has barred him from contesting in next month's presidential election. The court judgment, which also barred former Prime Minister Guillaume Soro, comes after the Electoral Commission announced that anyone with a criminal record would be disqualified from running from office. Both men have convictions. Mr. Gbagbo has been sentenced in absentia to a 20-year jail term over the looting of the local branch of the Central Bank of West African States during the 2010-2011 crisis. Mr. Soro was sentenced in April to 20 years in prison for concealment of embezzlement of public funds. Well, let's head on to our coverage on the coronavirus pandemic. A non-for-profit social enterprise in Tanzania, Ubongo TV, has accelerated its growth strategy as countries close down schools as part of measures to curb the spread of COVID-19. Now, Ubongo says it has now reached a massive 17 million families in 40 countries across the continent.
5-year-old Miguel Munene is learning how to pronounce the word fish from cartoon characters. This is due to the fact that the television has replaced his teachers and classmates after the government shut schools indefinitely in March in a bid to curb the coronavirus spread. The schools are closed until at least January 2021. Meanwhile, many children do not have the option to learn online, as the United Nations Children's Agency says at least half of sub-Saharan Africa's school children do not have internet access. Therefore, some children like Munene watch cartoons made by Tanzanian non-profit Ubongo, which offers television and radio content for free to African broadcasters.
Other programs is just for fun, but Ubongo, you see, like, it's helping children. Like, for example, many children don't like mathematics at all, but through Ubongo, they can learn and it's very enjoyable doing mathematics.
In March, programs by Ubongo, which means brain, were reaching about 12 million households in 9 countries. By August, it had risen to 17 million in 20 countries.
The COVID-19 pandemic has really kind of forced us to rapidly grow in order to respond to the needs of families across Africa. So within the span of 4 months between March and August, really, we were able to launch in 9 new countries. So in the beginning of the year, we were reaching 11 million households in 12 countries. Now we are reaching, I think it's over 17 million households in 20 plus countries across Africa.
Yeah. Okay.
The initiative was started by a group of artists, innovators and educators in Tanzania in 2014. It has received around $4 million in grants since and earned $700,000 from YouTube, product sales, character licensing and co-production of programs.
Why didn't you call us to carry you?
Well, let's head back now to politics. The 15-member Economic Community of West African States is demanding that Mali's military coup leaders must hand over power to a civilian transitional government immediately. This was ordered at an ECOWAS summit taking place in Ghana, headed by the chairman and Ghanaian President Nana Akufo-Addo. Today, the deadline expired for the ruling junta to appoint an interim leader after they initially proposed remaining in power for 3 more years. ECOWAS imposed economic sanctions after the August 18th overthrow of President Ibrahim Boubacar Keïta and said a new president should be appointed by Tuesday. Well, let's get more on this story from Joy News TV correspondent Elton Burbe, who joins us live from Accra, Ghana. Thank you, Elton, for joining us on the program. Do give us a feel of the summit today in Ghana, especially with this strict demand coming from ECOWAS to the junta.
Right, thank you very much, and thanks for having me. The meeting of the consultative assembly, if you like, this is at the behest of President Akufo-Addo, who is chair of ECOWAS. So since morning, the members have been meeting. We have representatives from Senegal, Togo, Niger, Nigeria, represented by the vice president, and of course, Goodluck Jonathan, who is the lead mediator for the Mali political crisis. Now, if you are seeing some movement behind me, I'm told that the meeting, the closed door session just ended, and very soon we will be having a news conference that will be addressed by leadership of ECOWAS, and that meeting will spell out the decision reached by this consultative meeting. But before the meeting went into that closed door session, President Akufo-Addo, who is chairing this meeting, made it clear that there isn't much time for the military regime currently in Mali to hold on to power, and that they expect to hear from them concrete measures they've put in place to hand over power to a civilian regime. And then that civilian regime will have within 12 months to usher the country into a democratic dispensation. Now, remember that on the 7th of September, when ECOWAS held its extraordinary Congress in Niamey, the directive went to the military regime in Mali, led by Colonel Assimi Goïta, that they should hand over to a civilian person by the close of today, 15 September 2020. The deadline would expire today. Now, what President Akufo-Addo told the meeting was that the leaders were yet to be told of the roadmap in terms of the handing over. So for them, there wasn't anything on the table. And for them, this particular meeting should bring finality to this matter that is brewing in Mali. And we know also that the military regime leader, Colonel Assimi Goïta, is part of this particular meeting. He came to Ghana about 2 days ago, and per the program that we were told before they went into the closed door session, he was to present a paper to the member states bordering on the social political conditions in Mali, and also tell the member states what the military is doing to hand over power. But even before this would be told, the military regime made it clear that in Mali, they've started the process of consulting identifiable groups, which include civil society organizations, on the best way forward to hold a free, fair, and transparent election to usher the country back into constitutional rule. And that the outcome of that consultative meeting has yet to be made public because they are still in the process of consulting relevant bodies. So they came to this meeting without meeting the ECOWAS deadline of 15th September, which means that now it's unclear whether they demanded an extension, or whether they will work within the time frame, directed by ECOWAS. The news conference that we are expecting within the hour will spell out the outcome of this meeting. But what Member State made it clear at the opening session was that they were not going to countenance any more delay in returning the country back to constitutional rule. And any further delay will witness additional sanctions imposed on Mali. There appears to be, solidarity from members who are attending this particular meeting, including Goodluck Jonathan, who also presented a report to the members. But like I said, all these were done behind closed doors. What we are waiting to hear is a communique, and followed by a news conference that I'm told will happen in the next hour. So the meeting itself has just ended. I'm told that the heads of states are back having lunch. When they are done, I'm sure that there will be departures, and then we'll get to know more when the ECOWAS representative speak to the media.
All right, Elton Brobe, thank you so much for that detailed reporting. We'll just have to wait and see how it all pans out there. Thank you once again.
You're welcome.
Joy News TV correspondent there, Elton Brobe in Ghana. Well, another coronavirus story for you. As the world continues to grapple with the pandemic, health workers in Morocco are complaining over worsening working conditions in the country's hospitals. Health workers in the country have taken to the streets to protest over inadequate manpower and ill-equipped medical facilities.
This hospital, located in the central city of Meknes, is designated to treat COVID-19 patients. However, Anas Karim, a nurse working at the hospital, says that there are only 3 nurses and 2 doctors available to treat 120 patients.
الممرضين وتقنية الصحة كيعيشوا واحد نقص كبير جدا وهذا النقص هذا
Imagine wearing full protective gear in the summer heat, working continuously for 4 or 5 hours, just so you can get through all the patients under your care. Patients that reach up to 120. 120 patients, all with their own health conditions. 120 patients, but only 3 nurses and 2 doctors.
That's why these health workers have taken to the streets to protest against the poor working condition in the country's health sector. Intensive care units in most hospitals are overrun. Other wards are full, and the National Nurses Movement says over 500 of their members have been infected, aggravating the shortage of staff.
As of today, we have had 526 cases of infections among nurses, which is a number we consider to be extremely dangerous. And so we are hoping that the Ministry of Health will give it the attention it needs. This number was tallied from our own efforts at a time of complete silence from the Health Ministry that has so far not published any statistics on the numbers of infected cases among health workers.
The kingdom recorded its highest number of cases on Friday, a record 2,430 new cases. Since the month of July, Morocco has been recording no fewer than 1,000 cases per day, the most aggressive surge recorded in any North African country.
Still ahead on Network Africa. As South Africa marks Tourism and Heritage Month, there are high hopes that President Cyril Ramaphosa will ease lockdown restrictions to level 1. Please stay with us. Welcome back to the program. South Africa's Health Minister, Dr. Zweli Mkhize, says about 12 million people, that's around 20% of the country's population, may have been infected with coronavirus. This is much higher than the official cumulative number of detected COVID-19 cases, which is 650,749. The new figure emerged from a research that was carried out by examining the amount of antibodies present in a patient's bloodstream. Meanwhile, about 3,000 undertakers have gone on strike in South Africa, demanding better pay and working conditions. They are refusing to collect bodies from homes and hospitals and to even hold burials, and their union is calling for the government to set up a coronavirus relief fund. We have joining us now for more on this, our South Africa Bureau Chief, Betty Dibier. Thank you so much for speaking to us, Betty.
Thank you, Lai.
First of all, let me ask, how are South Africans reacting to this report that about 12 million citizens may have been infected with COVID-19?
This is a rather technical paper. I don't think a lot of people are concerning themselves with it at this point. It's based on statistical modeling, and it's quite technical for just the regular people to understand, and is based on assumptions, for data collection for the country. And as the minister said in the statement that he made, the earlier seroprevalence, that's the prevalence of or the presence of the probably a virus in a sample test set. The previous study had put a seroprevalence for the country at 29 to 40%, and now recent study has been revised to say that probably about 20% of the population. Remember, the nearly 651 number of confirmed cases is just about less than 7% of the total 59 or 60 million population of the country. Like most countries where testing is being done, less than 10% of many of the countries or their populations have been tested. So in the case of South Africa, that's the picture. And the minister has said that a national seroprevalence study is going to begin, and then that will put them closer to really know the actual picture of the people. In another context, you could look at it as the number of people that will test positive to a virus within a mass sample tested. Testing of the blood serum now, not just the bloodstream, the blood serum, serology. So that's what they're looking at, to give them a closer picture of those who may even have that, added to those who have been confirmed to have it. That's what makes up that 12 million that he's talking about. So it's not actual figure, it's just assumption or statistical modeling that the researchers working with government have put forward.
All right, and are there fears perhaps that the country may be losing, its fight against coronavirus?
Certainly not. The country is moving to level 1 in a few days' time. Even the health minister said it. We now have a reduction since August the 22nd, I think. We've been having a fewer number of confirmed cases. It went from 15, 14, 13, 10,000. Now we have less than 3,000. In fact, yesterday, the number of confirmed cases was less than 1,000. And the number of fatalities has been going down. Saturday to Sunday, we had 20 new fatalities. I think Sunday to Monday, we had about 50 or slightly over 50. So generally, the number of the critical or the significant numbers been going down, which has given the minister the courage and all the other people advising the government as well to say, look, I think it's time for us to loosen up, lift some of the restrictions and move down to level 1 to allow for a little bit of recovery of the economy and then the general living of the people. So it's really not, that is not affecting the movement of the country to less restriction.
Yeah, indeed, a reduction in cases, that is what we are hoping for. Thank you so much, Betty, South Africa Bureau Chief Betty Dibier, joining us there from Johannesburg.
Thank you very much.
Well, South Africa's tourism sector is eagerly waiting for President Cyril Ramaphosa to address the nation this week to probably announce further easing of lockdown restrictions to level 1, as you've heard our South Africa Bureau Chief say. The sector, which contributes as much as 3% to the nation's gross domestic product, has been hard hit because of the COVID-19 shutdown, with losses running into billions of rand.
An unusual picture of Sun City, South Africa's iconic tourist destination, without people. The international establishment closed in March this year after President Cyril Ramaphosa announced the national state of disaster following the outbreak of COVID-19 in the country. For the first time in its 40 years of operation, it seemed like a ghost town. A picture replicated in other tourism destinations in the country.
We probably lost just over or around 120 million rand of revenue a month, an average of that sort of revenue a month. So yeah, it's as you can imagine, as you can imagine, it's been quite stressful for us in this period because you still had to, keep the resort running. We do rely on the international market, to put South Africa on the map, to give South Africa the exposure, and the people and the international travelers don't only come to Sun City. They do visit the other major cities in South Africa, and so it has an impact on the tourism industry.
Sun City opened its doors this September with the hope of reviving its operation, starting with local tourists. A major challenge remains the lack of international inbound flights and higher spending foreign tourists. Tourism SA says it is travel ready after 6 months of the lockdown, with industry players calling for the resumption of international flights. The Chief Executive Officer of Tourism SA, Sisant Chona, told us about a recovery plan still in the works.
We had to create a plan and look through the cycle, as it were. And the first part of it was about making sure that we protect the supply side of the tourism industry. So basically looking after the hotels, the museums and experiences so that they don't deteriorate or close down. Because what you don't want is after a couple of months to open up, but there's no tourism industry to speak of. So therefore, it was about protecting that. And some injections were made in terms of the UIF TERS, which is supporting, people that are employed salaries. Also included there was a tourism relief fund, which was aimed at really the emerging subsistence, small type of tourism play to hold them together as well.
We definitely need to kickstart African aviation in a much stronger position. I think you've seen a lot of the international stations, international countries are starting international operations. We are starting very, very slow, but obviously those countries are looking to come back into Africa. I think Africa is a very attractive destination for around the world, and we just want to see more and more people being able to fly in that way.
To support the sector during the harder lockdown levels, government provided a 200 million rand tourism relief fund, although there have been hurdles in accessing this for some. Industry watchers say more is required to turn the sector's fortunes around. And President Cyril Ramaphosa is expected to address South Africans this week with the possibility of easing restrictions further to lockdown level 1, with the decline in numbers of confirmed cases in the country. Then maybe the sector will begin the drive to recovery.
And that's where we end Network Africa today. Thank you so much for watching. I'm Layo Adegoke.